Hannah remains on her feet all day, working hours on end with shoes that are really tight and don't have great arch support. Welcome to the Dr. F Show, where we have a patient with a problem, identify the symptoms, diagnose the problem, and find some solutions.
And our first patient, Hannah Powers.
Good morning, Hannah.
Good morning.
And what brings you here with us today?
Well, Dr. Epps, I have been having some pain in my feet.
Really? Now
Yes.
both feet, or what are we working with here?
Mainly in my left foot.
Okay.
Yeah.
And tell me, Hannah, how often are you on your feet?
I work 2 jobs, so I'm on my feet all day, some days.
Okay.
Yeah, from like 6 a.m. to 11.
All right, tell me a little bit about your footwear. What do you like to wear to work?
Well, I mainly just work in Vans or Toms.
Okay. All right, ladies and gentlemen, that's where we can see our first problem with the foot pain. Vans and Toms are notorious for not having an arch support within the shoe. Okay, so tell me more. What do you wear on your off time from work?
I just slippers or barefoot.
Barefoot.
Yeah.
Again, ladies and gentlemen, all things that don't have the proper support for the foot's arch. Now, can we go ahead and take a look at your feet? Do you mind?
No, I guess not.
All right, let's go ahead and do that. Here we have your right foot. Now, is there any pain in this foot?
Not as much as the
Okay,
left.
perfect. Because here it looks like you got a nice longitudinal arch going, medial longitudinal arch. So let's go ahead and take a look at your left foot.
Okay.
Here we have your left foot where the pain is. And, yep, it's looking like the arch is a little less noticeable. I'm going to go ahead and bring in our specialist, Dr. Dane. World-renowned surgeon, orthopedic surgeon, Dr. Dane. So, did you hear all the sounds and symptoms from backstage of our guest Hannah?
Yes, I did. Yeah,
And we heard you took some x-rays.
yeah, we took some x-rays right before the show for sure.
Let's bring them on out. All right, doctor. What do we have here?
Okay, as we see here, we have the heel bone, the calcaneus, we have the navicular here. We have, on a normal foot, a very prominent arch going, right? But as we see in Hannah's foot, the arch is not that prominent on the medial longitudinal side.
Okay, doctor. So since it's only in one foot, do you agree that it was an acquired flat foot?
Yeah, probably acquired over time.
All right. So adult acquired flat foot deformity is what she has. Now, can you tell me a little bit about what causes this acquired deformity?
Okay, so in the foot, we have a lot of supportive structures here, coming from the calcaneus all the way down to the digits of the toes.
One of the main supporting structures of the foot is actually the posterior tibialis tendon, and that kind of pulls up the arch. Now, what happens when there's constant weight bearing on the arch and not enough support
Okay,
from shoes?
so when that happens, we'll have excessive pain and inflammation here, causing maybe a little rupture and falling of the arch.
Okay. So you said that the arch drops. Now, what happens in terms of the foot's motion while walking?
Okay, so when we do a heel strike, we are in dorsiflexion, and when we come forward, as we see in this picture, when the navicular drops, we go into excessive pronation, placing a lot of stress here on the medial side of the foot, where all the supportive structures are.
So we're getting another close-up on Hannah's foot here. Now, also what occurs when there's a flat foot is, since this is overly pronated, this side of the foot is overly pronated, the calcaneus and this joint tends to be everted more. So so there's an inversion that occurs here. And because of all the pressure pronating here, the navicular bone, which is located around here, tends to bulge out. Now, doctor, what if someone, in her case, her arch fell because of lack of support. What if someone is born with a flat foot?
Alright, so in a regular foot, without flat feet, the forefoot and the rear foot are on the same plane. But when you are born with flat feet, you tend to have a varus angle here called forefoot varus when the forefoot is on a very different plane. And when this is happening, it is causing excessive pronation here.
And because of this varus angle that the forefoot is at, when she has to go to reach toe off when she's walking, it requires more pronation for the toe to hit the ground, therefore causing excessive pronation.
Yes, yes. Now when this happens, we can get a compression force on this side, causing a lot of pain in the
Calcaneus area.
yes, in the calcaneus area.
Hannah was diagnosed with adult acquired flat foot deformity, and now before we give her the treatment of how to take care of this issue, I would like to first talk about preventative measures that she could have taken and you guys out there can take to prevent this from happening. And that would be to wear proper arch support, proper fitting shoes, not too tight, and just to limit your exercises. You want to go too crazy, just respect your body and treat it well. Now, doctor, how can she go about treating her flat foot on her left foot?
Alright, now Hannah, so we can do a few things here. One thing would be to strengthen the intrinsic muscles of your feet. We can do this by picking up some marbles, squeezing really tight, and putting them on the side or putting them into a dish.
With my toes?
Yes, with your toes off the ground.
Okay.
Very easy, very easy.
Okay. Sounds easy.
Okay, and another option would be to get proper orthotics for your foot, proper arch support. And, if you're involved in sports, you can do some taping, get the arch supported, the proper tape.
Supportive braces can also be made for the feet. And, worst comes to worst, the last thing that could be done would be surgery. That's always an option as well to help fix that arch. And, alright, thank you, Dr. Dave. For all your help today.
Wow.
Thank you.